Movement in the human body is modulated by the extrapyramidal system, which includes the substantia nigra, subthalamic nucleus, basal ganglia, and thalamus. The extrapyramidal system can either promote or inhibit movement. Let's take a closer look at the key extrapyramidal structures involved in Parkinson's disease. The basal ganglia are two large groups of nerve cells located near the base of the brain, which consist of the caudate, putamen, and globus pallidus. Together, the caudate and putamen form the corpus striatum, or striatum. The substantia nigra is a tiny structure located deep within the brain. There are actually two structures, but they are typically referred to as a single entity in the medical literature. Normal movement depends on adequate levels of the neurotransmitter dopamine, produced by cells in the darkly pigmented zona compacta of the substantia nigra, and delivered to the striatum and other parts of the brain. Because this motor pathway involves the substantia nigra and the striatum, it is known as the nigrostriatal pathway. The synthesis of dopamine begins with the amino acid tyrosine. Within the neurons of the substantia nigra, tyrosine is converted into levodopa through the action of the enzyme tyrosine hydroxylase. Levodopa is converted into dopamine through the action of the enzyme dopa decarboxylase. When signaled by an impulse traveling down the axon to the synapse, dopamine is released into the synaptic cleft. Some of the released dopamine binds to dopamine receptors on the receiving neuron, triggering a signal that is relayed through neurons to the motor center in the cerebral cortex of the brain. This signal eventually travels through the spinal cord to modify activity in muscle cells. Free-floating dopamine in the synaptic gap may be taken back into the neuron that released it and stored for future use, in a process called reuptake. It may also be converted into other substances through the action of the enzymes monoamine oxidase B, or MAOB, and catechol-O-methyltransferase, or COMT, COMT. Within the striatum, there is a delicate balance between dopamine and acetylcholine, another important neurotransmitter. In patients with Parkinson's disease, there is massive degeneration of dopamine-producing cells in the substantia nigra. The dopamine supply to the striatum is gradually reduced. This disrupts the balance between dopamine and acetylcholine, resulting in a relative excess of acetylcholine. When 60% to 80% of dopamine-producing cells in the substantia nigra are damaged, the extrapyramidal system loses the ability to effectively promote movement, and the motor symptoms of Parkinson's disease, such as resting tremor, rigidity, bradykinesia, and postural instability, begin to appear. Therefore, a primary objective of pharmacologic therapy of Parkinson's disease is to increase dopamine levels in the brain.
This gait is the gait that is a hypokinetic gait. The prototype is Parkinson's or Parkinsonian type of gait, in which the patient will have a posture which will be stooped over, leaning forward, and then will have difficulty as far as initiating gait. When the gait is initiated, there are small steps. Oftentimes there's a tremor associated with this. And as the gait progresses, there may be a picking up of speed, or what's called a fenestrated gait. And then in turning, instead of having the normal turning, the patient will turn en bloc, which means they'll turn almost as a statue moving around. And then, again, having difficulty starting in the marche petit pas.
People with Parkinson's Parkinson's disease have difficulty initiating and controlling movement. The symptoms often manifest in difficulty with gait, balance, and overall movement. Witness the power of personalized physical therapy. Through targeted interventions and skilled therapy, there can be a shift in momentum. Small steps become more assured, movements more fluid. It's a journey of progress, one step at a time. You can see a huge improvement following the intervention. The transformation is evident. This patient walks with renewed confidence, showcasing the remarkable impact of physical.
Early signs of Parkinson's disease. 1. Small handwriting. Your writing suddenly becomes tiny and cramped. This change is called micrographia. 2. Hand tremors. Slight shaking in your hands or fingers, especially when resting, can be an early red flag. 3. Slower movements. You feel like your body is moving in slow motion, even for simple daily tasks. 4. Muscle stiffness. You feel rigid or tense, even when you're trying to relax. 5. Balance issues. You may lean forward or feel unstable while walking, even without obvious cause. 6. One arm not swinging when you walk. It moves less naturally than the other side, often without you noticing. 7. Softer or shaky voice. You sound quieter or less clear than usual, even if you don't mean to. 8. Facial masking. People might say you look serious or blank. It's because your facial expressions fade. 9. Trouble sleeping. You toss, kick, or act out dreams during the night. Common in early Parkinson's.
9 best drinks to support Parkinson's naturally. Hydration boost. Plain water keeps the body hydrated, aids digestion, and supports medication absorption. Green tea. Rich in antioxidants, it may protect brain cells and reduce oxidative stress. Beet juice. Improves blood flow and may enhance brain function and muscle coordination. Berry water. Infused with blueberries or strawberries for antioxidant support and cognitive health. Coconut water restores electrolytes, supports nerve function, and prevents dehydration. Ginger tea helps with nausea, common from medication, and may reduce inflammation. Turmeric drink contains curcumin, known for anti-inflammatory and neuroprotective effects. Carrot juice, high in antioxidants and nutrients that support overall nervous system health. Lemon water supports digestion and detoxification, helping reduce constipation and improve energy.